Welcome to Medicine with a Fork, a clinician podcast from the educational nonprofit Gaples Institute, where we explore practical strategies for integrating nutrition into your clinical practice. I'm Jeanette Brooks, and today we're discussing how a patient's cultural traditions around food can serve as a bridge for clinicians to have more effective conversations with their patients about diet and health. Joining me is Dr. Stephen DeVries. He's the Gaples Institute's executive director, and he's also a preventive cardiologist and a faculty member at the Harvard T.H. Chan School of Public Health. Hey, Steve.
Great to be with you, Jeanette.
Glad that you're here. So I'd like to unpack this concept of adapting dietary recommendations to different cultural ways of eating. And let's start first with demographics in nutrition research. Can you tell us a little bit about the populations and the geographical regions that have been most studied in clinical nutrition?
Really important point, Jeanette. Most of the largest nutrition studies, they've been conducted in Western Europe and the United States. And so the diets consumed in those studies naturally consist of foods more typically consumed in those regions.
Yeah, so sounds like a fairly narrow lens then in the context of the global population. So what challenges does that present then to clinicians who are working with patients to improve their diet?
In terms of applicability, the particular foods studied in Western Europe and the United States, they may not be accessible or even familiar to those in other regions or for those individuals whose cultural backgrounds don't commonly include the foods that were studied.
Yeah, so that does sound like it can cause a bit of a disconnect then in talking to patients. So when you talk about making cultural adaptations to the dietary advice, the evidence-based research that's out there, what specifically does that mean? How does that look in clinical practice?
Yeah, I'm referring to the need to adapt the principles that are learned from these large randomized controlled nutrition trials and apply them to foods that are more typical of other cultures, or what can be referred to as heritage diets.
Heritage diets. Yeah, I like that phrase. Can you say a little bit more about what that term means?
Heritage diets refer to an eating pattern that aligns with specific cultural traditions, and they feature foods that have been typically consumed over many generations. And what's remarkable about these traditional ways of eating is that they align with many modern principles of nutrition science.
Oh, interesting. Yeah, so it sounds like beyond just the cultural importance of heritage diets, there's scientific significance to them as well.
Absolutely. And we're only beginning to now understand with modern science the real ancient wisdom that underlies many of these heritage diets. And there's a great example I like to talk about that includes the combination of turmeric and black pepper. It's a combination of spices that are often found in curries that are part of many cultural cuisines dating back hundreds of years. Turmeric is a spice with very active ingredient curcumin that's a powerful anti-inflammatory agent. Now, turmeric is poorly absorbed in the GI tract, but by adding black pepper with active ingredient piperin, the bioavailability of curcumin is increased by 20-fold.
Wow, that's incredible.
Yeah, it's a great example of how this ancient wisdom, not understanding anything about bioavailability, but the combination of turmeric and black pepper has real health benefits in addition to being a delicious combination. Another example is a cooking preparation with roots going back in Mexico and Central America hundreds of years. And it is the idea of cooking corn together with limestone or some other alkaline solution. And this is a process that's got an interesting name called nixtamalization. And this nixtamalization, cooking corn in an alkaline solution, it has the benefit of substantially increasing the bioavailability of niacin that is bound within the corn. And so what had traditionally been populations with a high prevalence of pellagra, which results from niacin deficiency, saw an improvement in health as a result of this ancient tradition of beginning to cook corn in an alkaline solution.
That's really fascinating.
Isn't it wild that
Uh,
obviously no idea that this had anything to do with anything related to niacin, but there must have been a realization that cooking corn in that way led to some better health outcome that was perceived on some level. One other example is the combination of eating beans together with rice. This
mm,
is a combination that's common to many cultures. Now, it's important to point out that all plant foods, contrary to some ideas, all plant foods do contain all of the essential amino acids. But clearly, some plant foods contain more amino acids of certain types than others. So, beans happen to be generally low in the amino acid methionine, but high in content of lysine.
mm.
Whereas grains, the opposite. Grains have a low content of the amino acid lysine, but relatively high amounts of methionine. So the combination of beans and rice balances this distribution of amino acids and is yet another example of ancient wisdom being great for health as well as being delicious.
For sure. Yeah, those are really amazing examples. And yeah, regarding beans and rice, you mentioned how that combination shows up in so many different cultures, sometimes
Mhm.
spiced a little different or prepared a little differently. But it's so interesting that something so healthful is so prominent across all these different cultures. Can you tell us, are there other foods like that that are health promoting staples that we see that are common to most or all heritage diets?
Yeah, absolutely. We know from the large nutrition studies that green leafy vegetables are amongst the healthiest types of foods that can be consumed. But we also know that greens can vary across cultures. So instead of recommending only one type of green leafy vegetable, whether it be kale or anything else, we can look across cultures and examine, say, the African heritage diet, where green leafy vegetables may be more familiar in the form of mustard greens or collard greens. We can look at
Mm.
Asian heritage diets and think about Napa cabbage or bok choy or even green seaweed. And Latin American heritage diet, we can think more about maybe lettuce or mixed field greens.
Hmm. Yeah, it's super interesting to widen the net beyond the typical things that we think of, which is for most of us, spinach and kale, right? That
Right.
there's lots of other options out there. Are there other health promoting foods that show up in different expressions like that across many cultures?
Yes, whole grains are another great example. We know
Mm.
clearly that whole grains are a health promoting type of food. But again, the specific type of whole grain can look very different across cultures, and it's not a one size fits all. Say, for example, in an Asian heritage diet, we may recommend brown rice or barley. In
Hmm.
a Latin American heritage diet, that could look more like quinoa or amaranth. And an African heritage diet, we could be thinking about millet or teff or sorghum. So again, keeping the principle of emphasizing whole grains, but having them take different expressions in different cultures, really important.
Yeah, that's really significant, isn't it? That so many cultures have really their own spin on these kind of superstar foods that are
Right.
so healthful.
Another important characteristic of heritage diets is the absence of refined carbs and the absence of highly processed foods.
Mm.
Obviously, these heritage diets did not have ways to process foods in an extreme, ultra processed way. So,
Hmm.
traditional culinary practices rely heavily on whole foods and minimal processing. Huge advantages right off the bat.
Hmm.
Or as a medical student who recently took our nonprofit's nutrition course that includes discussion of these cultural adaptations to healthy eating, the medical student put it in a way I really like. Something to the effect of, I love being able to think about how food was prepared hundreds of years ago is something we can return to and learn from.
That's really insightful
Hmm?
to view it like that and accessible, really. That's a good kind of a litmus test of, is this healthful? Is it something that would have been on my ancestors' plate 100 years ago? That's
Right.
really great. So, this notion of focusing on how our ancestors prepared their meals, it certainly underscores a concept that you've shared before in our podcasts, and that is that typically food prepared at home is inherently more healthful than
Mhm.
pre-made manufactured food products or stuff that you order at restaurants. So speaking of food prep, when patients make that shift toward preparing their meals at home in their own cultural tradition, one of the choices that they're tasked with is choosing what dietary fats or oils they cook with. And I know that fat is something that sometimes patients have questions about. What do clinicians and their patients need to know about making healthy choices when it comes to dietary fats in their own heritage diets?
Yeah, really important point. We know that extra virgin olive oil is the dietary oil that's been best studied with regards to health benefits. But we also know that olive oil can be a tough sell to a person who didn't grow up cooking with it or whose traditional foods typically feature other types of dietary fats. So one thing we do know across the board is that liquid vegetable oils like avocado, canola, or peanut oil, they're healthier choices than solid fats like butter or lard. So a good rule of thumb that we can apply across cultures is to encourage patients to lean toward plant-based oils over animal-derived fats whenever possible.
Okay. Yeah, that's really practical. It totally makes sense. Now, sodium is another topic I want to ask you about because this often comes up in a clinical setting. And I know that as a cardiologist, it's probably something top of mind for you, right? When patients are
Right.
looking for
Exactly.
dietary advice. So, what do you want clinicians and their patients to know about sodium when it comes to heritage diets?
Yeah, really great that you pointed that out because some heritage diets do include high sodium sauces. And
Hmm.
Asian diets are ones that are common in that regard with the use of miso and soy and other
Yeah.
high salt fish sauces. We'd encourage patients to use those high salt sauces sparingly or to
Hmm.
make lower salt versions of them at home. In place of some of those high salt sauces, we should be encouraging patients to use other products in place of sodium, like garlic or onions or other spices that are more common to their particular cultural tradition. So the important thing is to make it flavorful, use spices that are familiar, but try and cut down to the extent possible on salt.
Yeah, that's great advice. And you can never have too much garlic or too many onions.
Completely agree.
And it's really great to know that patients don't need to give up their favorite flavors in order to level up the health of their meals. So let's bring things home here and talk about why it's so important for clinicians to be aware of these cultural implications that we've been talking about. How do you see heritage diets as a tool for clinicians to have more transformative conversations about nutrition in patient care?
Yeah, that's what it's all about. First and foremost, when making dietary recommendations, we've got to be guided by the science. But also, we need to treat patients as individuals. And so it's important to encourage patients to eat health promoting foods that they're already familiar with. And we can help them by adapting the evidence base that we have in a way that aligns with their cultural preferences instead of trying to replace them.
Yeah.
We want to reinforce the strengths of traditional diets, such as being free of refined carbs, and focus on whole, nutrient dense ingredients. And in that way, we can make positive dietary changes feel a lot less daunting.
Yeah, that's a really empowering approach.
And when patients see that their cultural traditions are valued, they're much more likely to engage with and sustain dietary improvements.
Yeah, and I love that concept of building on what they already embrace and the fact that we can leverage good nutrition while still honoring and elevating a patient's cultural preferences at the same
Mhm.
time.
Yes, absolutely. That's what it's all about.
For sure. Steve, thank you. This has been such an enlightening conversation. Really appreciate you sharing your expertise.
Thank you, Jeanette.
And to our listeners, thanks for tuning in today. If you're looking to broaden your clinical nutrition knowledge, the nonprofit Gaples Institute has just the resource for you. It's an interactive, on demand CME course specifically designed for you to build your knowledge and confidence in talking to patients about their diet. It's 4 CME credits, and it even includes interactive patient education materials. And of course, AMA members do receive a discount. You can learn more at nutrition4docs.org. That's nutrition, and then the letters FORDOCS.org. Thanks again for joining us today, and we'll see you next time on Medicine with a Fork.